listener production.
Hi, Natarsha Belling with you and welcome to the afternoon edition of The Briefing. Mental health is a key focus of the coronial inquest that's currently underway into the mass stabbing attack at Bondi Junction last year that left 6 innocent people dead and at least 10 others injured. Experts have warned for years our mental health system is broken, with millions of Australians and their families falling through the cracks with horrific consequences. In our deep dive today, we speak with the President of the Australian Association of Psychologists, Sahra O'Doherty, about why our governments have failed us and the urgent need to properly fund and support our mental health system. But first, let's check the afternoon headlines this Tuesday, the 29th of April. Heartbreaking evidence from the New South Wales Police Inspector Amy Scott at that coronial inquest into the deadly Bondi Junction mass stabbing. The hero officer who shot dead Joel Couchy admitting in court she felt nauseous running into the shopping centre in April last year because, quote, in my head I had resigned myself to the fact that I was probably going to die. Inspector Scott added she knew she couldn't wait for her colleagues to arrive. She just had to go in. The state coroner praised Inspector Scott for her incredible leadership during the terrifying ordeal. The jury for the triple murder trial involving Erin Patterson has been selected, with official proceedings to get underway shortly in the small Victorian town of Morwell. Patterson is accused of serving a beef Wellington dish with mushrooms in it that allegedly led to the deaths of 3 people, including her in-laws, and left another in hospital. Patterson has pled not guilty to the charges. And a very expensive fighter jet has somehow slipped overboard and been lost at sea in the Middle East. Sailors aboard USS Harry S. Truman were reportedly towing the jet, which is worth 93 million Australian dollars, into place when they lost control and it went overboard. One sailor was injured, with investigations underway into what went wrong. It's not yet known if they will try and recover the lost jet. Now it's time to get into our deep dive with the President of the Australian Association of Psychologists, Sahra O'Doherty, on our broken mental health system. She explains what action needs to be taken and why. Sahra, thanks so much for joining us for this really important chat. If I can start by asking, we are just 4 sleeps away from the federal election on Saturday. Are you happy with anything that either party or the independents or Greens have provided regarding mental health?
It has been a really disappointing set of promises from the major parties. We know that Labor is putting a lot of money into these urgent care clinics, which is really just a rebrand of the clinics that had already been available previously in that Head to Health program. The Liberal Party have decided to promise to up the mental health care plan sessions from 10 up to the 20 that were previously available during COVID, which is okay, but it really just doesn't go far enough. Part of what the Australian Association of Psychologists has been campaigning for is really to be investing in what the core of Medicare is, which is making sure that the people who need it are able to access all of the treatment that they are able to get at a cost that is effective for them. And so we have been advocating for that rebate to be increased because it's been stagnant since the inception of Medicare. And we're wanting it to be so that the people who are at the really intensive, pointy end of that mental health spectrum are going to get the sessions that they need to get a proper recovery and not just a Band-Aid solution.
Sarah, your research from the organisation has shown that basically the major barrier to psychological care and people getting the help that they so desperately need is cost. Can you break that down for us?
Sure. So currently there is what's known as a 2-tier Medicare rebate system where a proportion of psychologists are able to offer a higher Medicare rebate. So these are psychologists only with clinical endorsement, and that represents about 30% of all psychologists in Australia. The rest of psychologists, including those with other kinds of endorsement, so things like health endorsement or forensic endorsement, are on this lower tier of a rebate. And that rebate has, in my career, only changed about $12 in the last 10 to 12 years. So the cost is prohibitive. It means that a lot of psychologists, unfortunately, because we're all in the same cost of living crisis, we can't really bulk bill as much. We desperately want to. But what that means is people are having to ration their sessions or choose between coming and seeing their psychologist or the cost of rent and groceries.
Sahra, for you, we all know the mental health system is broken for a variety of issues. It's incredibly complicated, but more than ever, it's incredibly important that we look at fixing it. If you can just unpack from the start of someone suffering mental health issues, you can even take it back to the fact that even when they're taken to emergency, there are not the beds there that they need that critical care when they're having a psychotic episode.
Absolutely. And what we see is there's two systems there that you've just mentioned there, Natasha. There is the federal system, which is Medicare, and then we have the state-based systems, which are our hospitals that we know are understaffed. We know there aren't enough beds there, and we know that there aren't enough experts working in those hospitals because of a workforce shortage. There aren't enough psychiatrists, there aren't enough psychologists to support people who really are at that intensive level of need for mental health support. When we come to the federal system of Medicare, there often aren't enough sessions for people who require those sessions to make a full recovery. So we have quite a lot of people who maybe present with mild to moderate symptoms. Maybe there's been an upset or a disruption in their lives. Maybe they're experiencing anxiety or depression. They may only need a few sessions of Medicare. But then we have people who they come into therapy, they have a great experience with their psychologist, they are managing a little bit better with their everyday stress, but then they start to open up about childhood trauma, or they might have had a domestic violence relationship, or there might be something larger that they need support with, and then they only have access to those 10 rebated Medicare sessions under their mental health care plan. And often they aren't really making the steps to recovery that they need to be making. They're having to pause their treatment, perhaps even it lapses or goes a bit backwards, and then they're eligible to come back in the following calendar year for potentially more treatment.
So, Sahra, in regards to, I guess, solutions, because we need to be solution-driven, if you can unpack this for us, because we've seen lots of promises, again, with health front and centre from all political parties, but yet again, mental health has been completely left out of any solutions or policies. How can we fix this broken system?
First of all, I just wanted to say it has been completely disappointing from a psychologist and psychology association perspective to see how little emphasis both the government and the other parties involved in this election are not making mental health care a priority. There just has not been that focus on mental health care. And unfortunately, what that means is there aren't really those expectations for the system to change very much. Now, what we are calling for with the Australian Association of Psychologists is we need to increase that Medicare rebate. Rebates mean less out-of-pocket fees for people. And it also means that psychologists would be able to bulk bill more. I would love to bulk bill. Unfortunately, we are all in the same cost of living crisis together. And a lot of psychologists are just simply not in a position to bulk bill. And what we do also need is more Commonwealth-funded places at universities for those postgraduate psychologists to graduate out of their master's courses and straight into the workforce. We have so many bottlenecks, and part of that is we don't have, for instance, paid placements for newly graduated psychologists. I'm concerned about these urgent care clinics because I wonder about how they're going to be staffed. I wonder about who are the psychologists who are going to be seeing all of these urgent patients when we don't have capacity, we don't have the workforce for it. Are they going to be palmed off in the same way that people are made to wait at emergency room departments?
You make a great point there because it's all well and good, and we've seen it from both sides of government, both levels of government, big shiny new hospitals for election promises or to buy votes, but they actually don't put the money into actually ensuring the staff are well-resourced, well-paid and well-supported. The other big issue we've seen in many states and territories across the country is not just doctors, but also well-trained, well-experienced psychologists walk off the job because they cannot work under those circumstances anymore. How dangerous is that for patient care right now?
I would say that a lot of our members are burnt out. A lot of the psychologists across Australia are burnt out. But just like any other helping profession, we step up, we want to do our job, and of course we want to do that well. And one of the things that is continually disappointing and saddening and frustrating for us is we don't often have the resources to do that job well. We don't have a lot of adequate pay in the public sector, and we are under-resourced with Medicare in the private sector, in the federal sector.
Sahra, in regards to, I guess, the current federal election campaign, with being incredibly disappointed about mental health not front and centre as part of the health solutions, unfortunately, we see many of these news events that are front and centre or leading the news bulletins, that then there's evidence that these people have slipped through the cracks. Yet again, we see the deadly and horrific consequences of people falling through the cracks in the system, of a broken system. How can we change this? How can we make sure people are well supported and that we don't have these lives ripped apart forever?
Absolutely. The access issue to mental health support needs to be streamlined. At the moment, a person has to either present to emergency or go and see their GP. And seeing that GP, there's a cost barrier, there's a time barrier, there's a waiting barrier. In rural and regional areas, there just aren't enough GPs out there to be able to service their communities. Then there has to be a mental health care plan, which is put in place. And then the person has to go off and find a psychologist. And just like meeting a new person anywhere, the first psychologist that you try might not be the best one for you. Having the mental space and capacity to shop around and find somebody who is able to support you, who has the skills to be able to support you, is a really challenging situation for anyone to be in. And so finding new and more creative ways of streamlining that process, for instance, having self-referrals to psychologists. So moving psychology into primary care so that you don't necessarily need a GP's referral to go and access mental health support is definitely one solution. Collaborating with GPs more so that there is less paperwork and bureaucracy to maintain those referrals is definitely another solution. We're absolutely pleading with the government to help us to help the community more.
So in regards to preventing these tragedies and enabling people struggling with mental illness, that I think many of us know the infuriating and disappointing scenario about this is if you get the right support, it is possible to live quite a good life if you continue to have the right medication or the right psychological support. What would your message be that there are solutions? Whilst we know the system's broken, there are very, very achievable solutions that we can help millions of Australians and their families live a much better, safer life.
There is so much information out there already, which is a great first step. Education is absolutely key. There needs to be a lot more public awareness about how to easily access a trained mental health professional. We have to make sure that people are aware that early intervention is so much more effective in preventing all of these later tragedies that we might see. And so we do need to focus on getting in early when that person might just be starting to show some of their symptoms in order to then ensure that they are safe and that the people around them are also safe.
Sahra, we appreciate your time and thank you so much.
Thank you so much for having me.
That was Sahra O'Doherty, the president of the Australian Association of Psychologists. And that's it for this episode of the afternoon edition of The Briefing. We'd love you to subscribe or follow us so you don't miss our episodes or our deep dive of the day. You can also follow us on our socials, on Instagram at The Briefing Podcast, and also on TikTok and YouTube. You just need to search Listener Newsroom. That's spelled LISTNR. And we'll be back in your feed tomorrow morning at 6 a.m. I'm Natarsha Belling. Thanks for your company. See you then.